KwaZulu-Natal has the second highest HIV prevalence rate in South Africa, with Mpumalanga taking first place. According to the latest HIV prevalence incidence and a behavior survey by the Human Sciences Research Council, those between the ages of 25 to 49 years accounted for 31.1% of the numbers, 38.4% being female and males being 21.5%. The study shows that the HIV prevalence in the province dropped to 16% in 2022, down from 18% in 2017. Let's get into the findings. So the key findings of the survey with the Chief Research Manager in the Public Health Societies at HSRC. He's also one of the principal investigators of the study, Dr. Shandeer Ramlakan. Dr. Ramlakan, very good morning to you. Thank you so much for making time for us this morning. So we have been reporting over the years that KwaZulu-Natal has the highest HIV prevalence, and now they have been surpassed by Mpumalanga. Is it clear as yet what happened?
So we have been, so KwaZulu-Natal has basically been surpassed by Mpumalanga, but when we look at the actual numbers, the raw numbers, it still means that there's about 2 million people in KwaZulu-Natal that are HIV positive. So we're going to be very careful when we actually just look at the percentages, because percentage-wise, yes, KwaZulu-Natal is now second, but numbers-wise, it is still high up. Now, when we look at what happened, I mean, if you look at the difference between Mpumalanga and KwaZulu-Natal, KwaZulu-Natal is sitting at about 16%, that's the prevalence rate, whereas Mpumalanga is sitting at about 17.4%. Now, that is not a very big difference, and that's what I said, but if you look at it in outright numbers, the numbers say a different story. The numbers are much bigger in terms of that when you look at the population of the provinces. Now, what could have happened is we are still basically investigating that. So we have, of course, released these numbers to say, hey, this is what the situation actually is. But it could also mean that it's an increase in the population size of KwaZulu-Natal. So what we know is from the previous, or from the last census that was basically done, the population in the country as a whole has basically increased. So sometimes when obviously the population increases, it does mean that there is now more people that are living in the province that are HIV negative, and of course less people therefore living that are HIV positive. So that could be one of the indicators that are there. But I think we're also going to look at some of the other positives that come out of the country in terms of the total number of people that are on antiretrovirals, or should say in the province. So if we look at the province as a whole, we have about 1.6 million people in the province of the about 2 million people that are on antiretroviral drugs. Now, that is a very high number, and that's something positive to actually look at.
Yeah, and also looking at the stats when it comes to people living in rural areas, HIV prevalence also higher among those residing in rural, formal or farm areas at around 20%. I remember the days of the movie Yesterday with Lelethi Khumalo, and with what that movie tried to address was the issue around knowledge and education about HIV, especially for people who work outside of the communities that they live in rural areas, to be specific. So what has happened in terms of the education and the campaigns around that?
Well, I must admit, we've been going around to all the provinces giving back this provincial feedback. And the one thing that we have noticed, as a team in HSRC, is the lack of these campaign boards. Now, if you remember back in the day, say about 2002, 2005, 2008, especially around the 2008 time, there was a lot of posters. I mean, taxis were adorned with the whole condomize. There was the whole abstinence things. There was a whole drive about basically male circumcision and stuff like that. But if you drive around now, how many billboards do you actually see in terms of condomizing? Now, so what we believe is that maybe the communications have actually dropped. And in these provincial dialogues that we've been having, because KwaZulu-Natal was the 7th dialogue that we actually had, what the colleagues are telling us at these dialogues is that they also see now a lack of communication. Now, once you go to rural areas, it's also harder to reach people, since people are actually much further away. And also to get to a clinic or a health care services is a bit more difficult. What we also know from previous experience is that if somebody now comes from a rural area and they somehow acquire HIV in an urban area, they then go back to that rural area where they basically go and seek treatment. So this is some of the reasons that we are actually looking at why it could be much higher in rural areas. So what we definitely need to do is make sure that we increase treatment and treatment adherence in the rural areas, get better communications campaigns in our rural areas. And this is not only about KwaZulu-Natal, this is all across South Africa. And get more people educated and also get more people tested. I mean, if you look at, say, a testing center in an urban area, you can set up a testing center at a corner of a street, and you'll have hundreds of people passing by that street corner. But whereas if you actually set up a testing center in a rural town, you'll then have to set it up like at a community center or somewhere in town. And the chances of actually now getting people from that rural homes into town or to that testing center is a lot more difficult. There's a lot more challenges there. And these are the things that we actually need to look at. I think one of the things that we've been talking about is that we have to take testing to the people and not expect people to actually come to the testing centers to actually So I think some of the conversations that have been happening around the provinces is maybe go to places like car washes, maybe go to places where people actually gather and do testing there and get people initiated on art, get them introduced to PrEP at places where people actually gather instead of expecting people to walk into clinics or come to a testing center.
Yeah, I wonder how many people would agree to be tested while waiting at a car wash, but that's a conversation for another day. I want to go to the findings around condom use, also dropped there from 2017 at 44.9%. It has dropped to 32.8%. And when I read that stat, Doctor, I thought that actually this could be because of the introduction of PrEP. But when I got to the section about the PrEP, I saw that only 6.7% of the respondents have taken PrEP. So why are we seeing a drop on condom use?
Well, that's a very interesting thing. So there's a few things that we need to basically look at here. One is that, first of all, I think I spoke about earlier, is that the advertising around condom use has basically dropped. So, we believe that could be one of the issues. And I think you are, fairly right when it comes to PrEP. So this is where we are now looking at further research and to properly understand this point of view. In our dialogues, what we also came to understand is that what people are telling us is that the people out there are actually taking PrEP, and the reason that we actually know this is because the STI prevalence is actually increasing, so the number of STI cases and the number of teenage pregnancies. What we also have been told during our dialogues is that what happens is that if you're looking at, say, Valentine's Day, what happens is that the number of people initiating on PrEP is higher, but as soon as Valentine's Day basically ends, then those people cannot be found. So, and if you basically have, say, a PrEP initiating campaign basically happening, then people go there and get on PrEP and take PrEP. But what tends to happen is a month later, those very same people that were initiated on PrEP, they cannot be found. So this is what some of the partners in the province are actually telling us during the dialogues. And these are some of the things that we are now, the data that we're actually gathering from the dialogues to actually go and look at it and do further research to actually see what actually are the reasons that people are not taking or not utilizing condoms. So this is something that we are definitely looking into.
Okay, then thank you so much for your time. That is one of the doctors who was part of a research that has been done by the Human Science Research Council, Dr. Ramlakhan, who's also the principal investigator. Thank you so much for making time for us.